After 50, our muscles, especially the glutes, naturally begin to lose strength and volume. Studies show that more than 65% of people over 60 have weak glutes, which can cause lower back pain, difficulty walking, and even falls. And I know many of you have experienced this. That feeling that one side of your body is weaker, or difficulty climbing stairs, getting up from a chair, or even standing for a long time. This happens because the glutes are fundamental muscles for our stability, balance, and mobility. When they're weak or uneven, the whole body suffers the consequences. But the excellent news is that with targeted exercises, even while sitting, you can reverse this situation and recover your strength and independence. And that's exactly what we're going to do now. I'm going to teach you 3 movements that you can do sitting in a sturdy chair without needing any equipment. Write this down. The first exercise is the seated glute squeeze. What it is. This is an isometric exercise, meaning you'll contract the muscle without making movement. It's perfect for activating and waking up glutes that are asleep. How it works in the body. When you consciously contract your glutes, you're sending a signal to your brain that these muscles need to work. This improves the neuromuscular connection and prepares the glutes for more complex daily movements. 1. Sit in a sturdy chair with your feet flat on the floor, hip-width apart. Keep your back straight without leaning against the backrest. Now, squeeze your glutes hard as if you were holding a coin between them. Hold this contraction for 5 seconds. You'll feel the muscles working. Relax for 3 seconds. Repeat 15 times. See? Squeeze. 1, 2, 3, 4, 5. Relax. Squeeze again. 1, 2, 3, 4, 5. Relax. Precautions. Attention! Don't hold your breath. Keep breathing normally while doing the contraction, and if you feel any pain, stop immediately and consult a professional. Now let's move to the second exercise, alternating leg lift seated. What it is. This movement works not only the glutes, but also the thigh muscles, improving balance between both sides of the body. How it works in the body. By lifting one leg at a time, you activate the glute on that side in isolation. This is perfect for correcting the imbalance between sides because you're giving specific attention to each muscle. How to do it. Step by step. 1. Continue sitting in the chair with feet on the floor and back straight. Place your hands on the chair beside your body for support. Slowly, lift your right foot off the floor, about 4 to 6 inches. You don't need to lift it very high. Keep your leg extended and abdomen contracted. Hold for 3 seconds at the top. Lower slowly. Now do the same with your left leg. Lift the right. 1, 2, 3. Lower. Lift the left. 1, 2, 3. Lower. Do 12 repetitions on each side, alternating. If you notice one side is weaker, pay more attention to it. Do the movement calmly, feeling the muscle work. It's normal for one side to be stronger than the other at first, but with practice, you'll balance them out. Precautions. Don't swing your body. Keep your torso firm and stable. And if you have knee problems, don't fully extend your leg. Keep it slightly bent. And we've reached the third and most powerful exercise, seated knee opens. What it is. This movement works the gluteus medius muscles, which are responsible for lateral hip stability. These are the muscles that prevent you from swaying when walking and prevent falls. How it works in the body. The gluteus medius is on the side of the hip. When you open your knees against resistance, you strengthen this area, which improves your balance and makes your hip firmer and more stable. How to do it? Step by step. 1. Sitting in the chair, place a resistance band, a belt, or even a rolled towel around your thighs, just above your knees. Feet on the floor, hip width apart, back straight. Now slowly open your knees, pressing against the resistance of the band. Open as wide as you can without feeling pain. Hold for 3 seconds. Return slowly to the starting position. Open. Feel the tension in your glutes. 1, 2, 3. Close slowly. Do 15 repetitions. If you don't have a resistance band, you can use an old belt, a rolled pantyhose, or even do the movement without anything, just imagining you're pushing something. The important thing is to feel the muscle working on the side of your hip. Precautions. Don't force it too much. The movement should be controlled and comfortable. And always keep your feet firmly on the floor so you don't lose balance. Very good. Let's quickly recap the 3 movements you learned today. First, seated glute squeeze, 15 repetitions, holding 5 seconds each. Second, alternating leg lift, seated, 12 repetitions on each side. Third, seated knee opens, 15 repetitions, with or without resistance band. You can do this sequence 3 times a week on alternate days to give your muscles time to rest and strengthen. But attention, this is very important. These tips do not replace a medical or physical therapy consultation. Before starting any exercise, talk to your doctor, especially if you have problems with your hips, knees, or spine. These exercises are safe for most people, but every body is unique, and a professional can adapt the movements to your specific needs. Agreed? If this video was helpful to you, subscribe to the channel and turn on the notification bell so you don't miss the next content about health and wellness after 50. In the next video, I'm going to talk about exercises to strengthen your legs and prevent falls. Something that perfectly complements what you learned today. It's going to be amazing. And tell me here in the comments, have you noticed weakness or imbalance in your glutes? Which of these exercises are you going to start doing today? I'm very curious to know. Thank you so much for watching until the end. Take good care of your health, your body, and see you in the next video. A big hug.